All right, let's talk about the big elephant in the room. Let's talk about the most important thing, which is everybody is concerned and fixated on, is the cost of full mouth dental implants. Full mouth meaning the entire top, the entire bottom. Case in example, let's take a look at this case. Every single tooth in this mouth, in this head, is completely failing. Teeth are decaying, and teeth are no longer savable. So, obviously, if we plan the case and what we call line item by item, meaning like, okay, take a look. By removing all these upper remaining teeth, by removing every single remaining tooth that's left, cleaning out the infection, and then placing anywhere between 4, 5, or 6 implants under anesthesia, the cost of gauze, the cost of facility fees, the OSHA, the cost of temporary teeth, the cost of implants, the parts, the pieces. If we really piece it out, I'm going to explain to you what it would be. So if this was done in a hospital, and if we did line item by line item, as it's done typically in a hospital, it would look something of like this. It would look like all these American Dental Association codes with different numbers, and like the cost would be exorbitant. And by the time you would be done, go to the next slide, the same full mouth implant for all-inclusive fee would be close to $105,250, okay? Because if you really look at it, the time, the investment, the expertise, everything that goes into it, there's huge. And this was done in a hospital, and this is, even if it was not done in a hospital, done in a local setting, and if you had to do it, if we had to price it by every single tooth, every single implant, bone grafting per site, in all the visits, all the follow-up visits, all the scans, that's exactly what it would be. But you know what? Patients need to understand is our fees are more than 50% less than what the full traditional fees are. We never do it this way. We never do it line item by line item. The way we have it in our office, and the patients that have come to us, is I make it very simple. I make it one simple pathway from start to finish. And what does it take to get all the bad teeth out, implants placed, even bone grafting, IV sedation, follow-up visits, and your permanent teeth, and any intraoperative appointments, your night guard, everything all inclusive is there, and it's one bundle fee. If there's any professional courtesy given, there's one bundle fee. It's never appointment by appointment, because if we did that, it just wouldn't make sense. Plus, we have an in-house lab. Because we can do it at scale, you always end up saving more money this way. We've seen so many patients that come from New York, from different parts of the country, that are told, and they're given this whole menu of treatment plan, and we've seen treatment plan exceeding 70, 80, 90, 100,000 in fees for full mouth implants. So, we're putting it out there, and the argument is, well, yeah, if this was in a hospital, my medical insurance would pay for it. Unfortunately, sure, if there was a medical procedure, medical insurance is mandated to pay contractually whatever minus the deductible it's going to pay for hospitalization and so forth. Even for like a hip or knee replacement, medical insurance is very different. Dental insurance is, in 1949 it's $1,000. In 2026 it's $1,000. It's nothing. It's not going to do anything for full mouth case. Even for a single implant case, it is absolutely no help to our patients, unfortunately. But that doesn't stop our patients. That doesn't prevent our patients from getting the ideal care done. But I wanted to put it out there, like, look, to get a full arch of kind of go back to where we came from, having all these teeth removed, the extraction of every single tooth, the cleaning the site of every single tooth, placing multiple implants, bone grafting it, all the temporary teeth, all the step-by-step approach. And if we had to really I take the patient from here and do a full mouth. This is what the final product looks like, with 5 implants on the top, 4 and this is like towards the end when everything is done. But you don't understand, a lot goes in between. So to go from here, and if you had to line item and do everything itemized, it'd be close to over 100,000 in fees. And that's the part that I like to have patients understand, is that, look, it doesn't have to be, because we can do it in such efficiency, and we can do it 50% or more less than what traditionally would be if we do it item by item, appointment by appointment. That's what patients want, and that's what patients appreciate. But I just have to get this educational video out there, is that this is how we do it. We bundle our fees. We give you one case fee to get your treatment done. Whatever needs to be done, we do it. We have to over-engineer, we do it. We have to change something, we do it. That's our commitment to you. So keep that in mind when you are looking for a dental implant office that is your fee all-inclusive. Are they kind of like doing a nickel and diming? How are they doing? Are they transparent? And are they transparent about everything that's included, and there's no additional? Then people ask taxes. In healthcare, we don't charge taxes, by the way. It's all inclusive of our expertise, what we can do to give you from state of unhealthy to a state of health, function, aesthetics, and quality of life.